All right, ladies and gentlemen, the president came out within about the past hour to give us an update on the daily briefing. He then hands it off to General Semonite to basically explain how himself and the Army Corps of Engineers basically helped convert certain areas, such as like the Javits Center and other areas, into different, more or less, field hospitals. So let's get right into it, Mr. President.
Thank you very much, everyone.
Welcome.
Thank you. Following the release of our reopening guidelines, governors across the country are looking forward to phase one and announcing plans for an economic resurgence. We're going to have a resurgence, too. At a time when millions of American workers and families are struggling with the financial consequences of the virus, it's critical to continue the medical war while reopening the economy in a safe and responsible fashion. During this time, Americans must maintain strict vigilance and continue to practice careful hygiene, social distancing, and the other protective measures that we have outlined and that everybody's become very familiar with. We continue to be encouraged that many of the areas hardest hit by the virus appear to have turned the corner. For example, recent deaths are down very, very substantially. You can compare that with their peak not so long ago, and you have numbers of 30%, 25%. In Detroit, as an example, it's down by over 50%. Congratulations. And in New Orleans, where they've done a terrific job, they're down 65%. 30 states have just one case or less per 1,000 people, far fewer cases per capita, as an example, than Germany, the United Kingdom, France, Italy, Ireland, Switzerland, Singapore, Belgium, Spain, Norway, the Netherlands, Austria, Sweden. My administration continues to press Congress to replenish the enormously successful Paycheck Protection Program, which has impacted 30 million American jobs. We hope to have an agreement very soon, and hopefully tomorrow the Senate's going to be able to vote. A lot of progress has been made on that, tremendous progress. It's a great plan. It's a great plan. It's helped a lot of people. So we hope to have a vote maybe tomorrow in the Senate. And based on the record low price of oil that you've been seeing, it's at a level that's very interesting to a lot of people.
Well, that's the thing. Basically, apparently, oil has gone negative. It had dropped down to about $1 a barrel down to about a penny a barrel. And last time I checked, it was like negative $37 a barrel. And how that works, well, as the president was saying, it's very interesting. It seems to be a certain mechanism that allowed that to happen. Continue, sir.
We're filling up our national petroleum reserves, the strategic reserves, and we're looking to put as much as 75 million barrels into the reserves themselves. That would top it out. That would be first time in a long time it's been topped out. We'd get it for the right price. We're also pushing for the deal to include an additional $75 billion, our deal that we're talking about, $75 billion for hospitals and other healthcare providers. Many providers and their employees have taken a huge financial hit in recent weeks, and visits, elective procedures, surgeries, et cetera, were canceled. We think that they can all get back online. They'll get it done. The hospitals have really been fantastic. The hospitals, they've stepped up to the plate. They've really done a great job. We appreciate it so much. For areas less affected by the virus, we've issued new recommendations about how to safely resume elective treatments. HHS has also distributed the first $30 billion in direct payments to 1 million healthcare providers across the country. We've also invested $1.4 billion in community health centers to ensure our most vulnerable communities, including many African American and Hispanic American communities, have access to the services and testing that they need. Earlier today, Vice President Pence spoke with governors from all 50 states about our unified effort to defeat the virus. He had a great call. It was a great call, very positive in, I'd say, every way. Prior to the call, we provided each governor with a list of the names, addresses, and phone numbers of the labs where they can find additional testing capacity within their states. many, many labs. We're providing you with the list. We'll show it to you now if you need it. We'll give you the details. But hundreds and hundreds of labs are ready, willing, and able. Some of the governors, like as an example, the governor from Maryland didn't really understand the list. He didn't understand too much about what was going on. So now I think he'll be able to do that. It's pretty simple. But they have tremendous capacity, and we hope to be able to help him out. We'll work with them and work with all of the governors. Similar to the situation with ventilators, states need to assess their complete inventory of available capacity. Some states have far more capacity than they actually understand, and it is a complex subject, but some of the governors didn't understand it. The governor, as an example, Pritzker from Illinois, did not understand his capacity. Not simply ask the federal government to provide unlimited support. I mean, you have to take the support where you have it, but we are there to stand with the governors and to help the governors, and that's what we're doing. And they have a tremendous capacity that we've already built up, and you'll be seeing that. We're going to be introducing a couple of the folks in a little while to talk about it. I want to draw your attention to Governor Cuomo's remarks during his press conference today. He said the president is right. The state's testing is up to the states to do, which will implement the tests and logistically coordinate the tests. We have about 300 labs in New York, and they're great labs, actually. And it's my job to coordinate those 300 labs. I think the president's right when he says that the states should lead, and the governor's they're really getting it together in New York. A lot of good things are happening in New York, and I think the governor's going to come in to see us tomorrow. He's coming to the Oval Office tomorrow afternoon. Andrew is going to be coming in with some of his people, so we look forward to that. Some of the articles that just recently came about, if you remember, and I put out a statement today, for a month it was all ventilator, ventilator, ventilator. That's all people could talk about was ventilators. And
well, that also was one of the initial concerns, because even in January itself, we were getting early reports out of Wuhan, China, that some of the folks, they had a severe shortage of ventilators. Unfortunately, when folks, they didn't have that additional breathing capacity there, that's unfortunately how you end up having tragedy. Continue, sir.
We did a great job with that. We built a lot of ventilators, to put it mildly. We have so many now that at some point soon we're going to be helping Mexico and Italy and other countries. We'll be sending them ventilators, which they desperately need. They were not in a position to build them themselves. But we have thousands being built. Every state they have the ventilators. If they don't, we have almost 10,000 in our Federal Reserve, our stockpile, as they call it. And we did a great job with the ventilators. Unfortunately, the press doesn't cover it, other than the fair press. But so then you say, gee, they need ventilators, we don't need ventilators. And that's under pressure we did that. Nobody that needed a ventilator in this country didn't get one. And a story that just came out, how the media completely blew the Trump ventilator story. I'm sure you'd love to see that. That's by Rich.
Well, this is the president essentially giving his opinion on the situation. The president does have the power of the bully pulpit. I'm not exactly sure what this has to do with the federal government's direct response, but continue, sir.
Lowry, respected journalist and person, how the media completely blew the Trump ventilator story, which unfortunately it did. And here's another one that just came out. Kyle Smith, the ventilator shortage that wasn't. The ventilator shortage that wasn't, because we got it fixed. And we're also going to help the states, by the way, stockpile ventilators. So if a thing like this should happen again, they've got them. The stories on testing are all over the place, that we're actually in good shape. I'm going to have the vice president and others speak to you about that, but we're in very good shape on testing, and we're getting better all the time. You're going to see some interesting things. I thought before I went any further, though, I'd like to have General Semonite, who's done an incredible job, tell you where we are. You know, we're still building beds in hospitals for people that need them. I guess the hospital business general is getting pretty much closed out now, but we're creating a lot of space for people just in case, and in some cases they probably will be using them. But I thought the general, he's been so impressive and done such a great job. I thought on behalf of the services and on behalf of the federal government, he'd say a few words about what we're doing right now. Thank you very much, General.
Well, thank you, Mr. President. Just want you to know that on behalf of all of us in the Department of Defense, our thoughts and prayers go out to all of those patients and all those victims that have been affected by this terrible virus. And the President and Vice President talk all the time about the heroes, but when I've been out there, I've seen the doctors, I've seen the nurses, and all those that have worked very, very hard. And we're just so proud to be part of this noble calling. For my team, I really made it very, very simple. I said there's 3 legs of this stool, and they all have S's. There's sites, in other words, hospitals. We've got to worry about supplies, and we've got to worry about staff. And so right when Governor Cuomo called the president about almost 30 days ago, he said, I need some help worrying about what could be tens of thousands of hospital room shortages. So the president and Secretary of Defense asked us to fly to Albany with a team. And on the way up, we understood how complex of a challenge this was. And we knew there's no way you can solve a complex catastrophe with a complicated solution. We needed a very, very simple solution to be able to then work with HHS, to be able to work with FEMA, to be able to work with the Vice President's task force, and then to be able to power this down all the way down to the local level. Some of the governors asked us to try to build a hospital in a parking lot or a field in 2 or 3 weeks. You can't physically do that. So what we said was, let's go to where there's an existing facility. And I'm going to kind of make this in 2 big pots. Those that are either hotel rooms or college dormitories, smaller rooms, or those that are in real large areas like field houses or convention centers. And we designed those standard facilities that could be either non-COVID or COVID, and then we got that approved here at the federal government to be able to then power that back down. So we went to Governor Cuomo, and he said right up front, I love the concept, I need you in the Javits Center, I'm ready to start having you work tomorrow afternoon. So when we flew back that afternoon, the next day, we basically built this standard design and then continued to be able to power it down all the way down through the rest of the team. So I just want to show you a couple slides here, and we'll kind of let you know where we're at right now, Mr. President. We had to do a bunch of assessments. So somewhere in the order of over 1,100 different locations we went to, and we worked for FEMA, we worked for the president, and we worked for governors and mayors. And we said, what do you think your demand is going to be? And based on a lot of the modeling that's been in this room here, we were able to understand when the peak curve was, but we also were able to understand where's the bed shortage. So then these 1,100 facilities, right now today, sir, we're actually executing 32 different facilities. That's on the order of merit of about 16,000 beds. 8 of those are all done. We've still got a lot more to complete. And in the next week and a half, we're going to complete about 15 more facilities. We've got some pending. Some mayors and governors are still wondering, do they have enough bed space? And what's important here is we need a very agile plan. You can't do something 3 weeks ago and think that this is going to continue to stay, because this virus gets a vote. And this entire team, the federal government, has tried to be as agile as they can, supporting those states and those governors. The beauty of the plan, though, is it doesn't have to be built by the United States Army Corps of Engineers. So we designed about an extra 52 facilities. We gave those to the governors, and I've got to be very, very laudatory to the governors. They then imposed and put a lot of those on the ground and did those themselves. So let's go to, I'm just going to show you some real simple pictures here. Go to the next slide if you don't mind. So this is an example of the Javits Center, and you've heard the president talk about it quite a few times. This one, about 2,100 bed spaces. What you get is about a 11 or 12-foot square cubicle. There is lights in there. There's a nurse call, so if you need to be able to call the nurse station. There are nurse stations throughout. There's pharmacies throughout. This one started as non-COVID, but then we came back in and put in central oxygen. So everybody has oxygen right behind their bed to be able to take care of those patients. And again, built this one, about 1,000 patients treated. Let's go to the next one. I was up in Detroit with Governor Whitmer, and she walked us through and told us her intent. Here's where she needed to do this in the TCF Center. You'll see all the cubicles that are laid out. This is right in the middle of a convention floor where there might be like a boat show or a car show, and then went in and built 970 different capabilities there. And again, a lot of great work by my guys in the Corps of Engineers and the rest of the mayors and the city's team all pulling together. Let's go to the next one. This is called the McCormick Place. Governor Pritzker sat us down. He said, here's kind of our intent of what you want to do. Mayor Lightfoot walked us through, and we went into another large convention center. This is actually 3,000 bed spaces, a very, very large build, and got this one done in a relatively short time. And then here's another one that kind of helps you understand the dynamic here. Go to the next one, please. This is in Miami Beach, and I flew in to see Governor DeSantis. And my guys had kind of scoped out about 450 beds, and he said, Todd, how long is it going to take to build this? And we kind of said probably till the 27th of April. And he went to his health people and he said, how long do you need? And they said, the day we need this is the 21st of April. And I told my guys, you don't have till the 27th. Figure out how to get it done by the 20th. This is where you don't get to build to be able to have the perfect solution. You got to be able to get the mission essential done. Lives are on the line here, and we've got to be able to get everything done to be able to save those lives. And let's go to the last one here. This is one we're doing right now, Colorado. This is in Denver, another gigantic convention center. You'll see all the different cubicles here to be able to just bring in that oxygen, 6-inch copper pipe that comes in, and it's all piped throughout the entire convention center, 6 miles of pipe that's able to go in to be able to make that happen. And in closing, I just want to be able to say that we are very, very focused in the Corps of Engineers getting this done. But this is all about the team, the federal team, the state team, the local team, the vice president's task force, and a lot of the people sitting here have informed us of how fast we need to go. And it goes back to, again, all the governors and the mayors that make this happen. But I want to reiterate, President Trump has called me 3 times, and Secretary Esper has been on the phone at least one of those times and said, what else do we need to do to set you up for success? Is there any other knobs we can turn to be able to help you go? And you think about that equation of those 3 S's, I think that with the federal government and the mayors and the cities here, we've effectively taken that first S out of the equation. And so I can't tell you, of all the things I've done in my career, this is a noble calling to be able to step up and save American lives. So with that, sir, I thank you very much.
Fantastic, Jeff. Thank you very much.
All right, that was General Semonite, and we had President Trump's initial remarks there. It appears that there is still hospital construction underway. As we saw, it looks like they were busy kind of wrapping up stuff down there in Florida for Miami, as well as a Colorado convention center as well. Here's the thing. It's when push comes to shove, it's like we can do absolutely amazing things, whether it's mass production of ventilators, masks, gowns, other PPE, or just setting up hospitals. Because here's the thing, it's like, yeah, America is a location, but America is also a people. That's the thing. The Americans that are here, people's lives are on the line, and people are stepping up. We can Monday morning quarterback all day long throughout all the history about what we coulda, shoulda, or maybe could have done. Here's the thing. We're here now. We got to do the best we can to help protect our people. So thank you all for tuning in. Peace out, everybody. Stay safe, and long live the elbow bump.